Black Americans living with multiple sclerosis are being encouraged to pay attention to their symptoms and advocate for their health. MS is 3 times more likely to develop in women, and Black Americans have a greater chance of developing progressive symptoms. Poet Azure Antoinette, who lives with MS, is joining us this morning alongside neurologist and MS specialist Dr. Mitzi Joy Williams. Thanks for being here today.
Thank you so much for having us.
Thanks.
Doctor, let's start with you. Can you tell us more about the symptoms of MS and what are some of the early warning signs your patients have shared?
Absolutely. So MS is an autoimmune disease that attacks the nerves. And so we see very commonly symptoms such as visual loss, difficulty with numbness and tingling on one side of the body or the other, or problems walking. In addition to these physical symptoms of MS, we also see invisible symptoms, including fatigue, which affects daily activities, as well as cognitive dysfunction.
And how does the MS experience for Black Americans differ from other patient populations?
So the symptoms are the same, but the outcomes are different, much like many of our other conditions, especially here in the U.S. So what we see is that there's a little bit more visual problems, a little bit more walking difficulty in the Black population, but primarily we see more disability in the long term. So people have to use walking devices such as canes or walkers, sometimes up to 6 years earlier than their white counterparts. And also we see people having more cognitive dysfunction in the long term, and in some cases earlier mortality at younger ages because of the burden of disease.
So Azure, let's bring you into this conversation. Tell us what motivated you to get involved and participate in this new public service announcement, along with the documentary.
You know, it seems odd to say that I was excited to be the face of a disease PSA, but I am. I'm super stoked to be the face of the multiple sclerosis MoreToMS.com campaign. It kicks off today with our documentary that just launched on the site, MoreToMS.com. It's a PSA, a documentary about Black Americans living well with MS, and not just living with MS, which is a debilitating lifelong disease, but thriving. MS for me started in my 20s. I didn't get diagnosed until I was 28 when I had fully lost my ability to walk. Before then, it was tingling. It was an inability to tie my shoes. Sometimes I would fall downstairs or not be able to walk or write, or I wouldn't be able to remember things. All things that were supposed to happen way later in my life. But MS is funny because it doesn't always reveal itself straight away. So it's something that you have to really come to terms with. And sometimes it can just feel a little bit shameful and embarrassing. But by the time I got diagnosed, a lot of years and time had passed. I'm grateful now to have a diagnosis and a medical team and a care team that can look after me and help me get on my journey to wellness and stay there. So I am very, very excited to be a storyteller in my regular personal and professional life, and to be applying that to this campaign as the front-facing space, to be to be front facing for MoreToMS.com, which is really just inspiring people to understand that this is a campaign worth learning about, whether you have MS or you know somebody who has it, or you're just learning about it for the first time. We want to empower you and inspire you that this disease is not the end. We want to teach you how to live with it, and we want to teach you how to thrive with it.
And I think it's great that you are putting your story out there, because clearly it has had a big impact in your life. Any one piece of advice that you give people about living well and staying active when you have MS?
What advice do I have about living well and staying active? I think you need to be kind to yourself. You need to be kind and compassionate. Speak up and ask for what you need. Be your best advocate. Dr. Williams has been an incredible force of knowledge for me in the short time that we've been working together. I've learned so much more about the disease. So having a great medical team is going to be critical for you. If you're not getting the answers that you need, get new people. Get a new medical team that's listening to you and purposing to really focus in on what you need. You know your body best. So listen to yourself. Get people that are listening to you too, and don't take no for an answer. It's not a race. It's long-standing.
Yes.
Stick it out.
And doctor, any advice that you have for patients on how they can really advocate for their own health and talk to their doctors about MS fatigue?
Absolutely. I think that, Azura states it so beautifully, the importance of self advocacy and speaking up if you're having issues. I think another key important piece is to have a good support network and to use those folks who are your care partners and support partners to help be a part of the healthcare team because they provide valuable information that helps us get the big picture of how you're doing on a daily basis. So don't be afraid to bring that care partner with you. Let them speak up when you're having issues, and it can really help us all work together so that we can find the best treatment and the best plan for you to live well with MS. And go to that website, moretoms.com, and check out the PSA and documentary. And we're so excited to be talking about this, and thank you for lending some time to this extremely important topic.
All right, Dr. Najur, thanks for joining us in that conversation this morning.